Did you know that heart disease is the leading cause of death in the world, killing more than 17 million people every year? The scariest? Many of these lives could be saved if the heart's warning signs were recognized in time. How many times have you felt extreme tiredness, a strange pain in your chest, or a simple swelling in your feet and ignored it thinking it was no big deal? Well, I'm going to tell you, your heart may be trying to talk to you, asking for help. In today's video, you will learn to recognize the 7 main danger signals that your heart sends before something serious happens. These signs may seem harmless, but ignoring them could cost you or someone you love your life. So, stay with me until the end, because not only will I explain each warning, but I will also teach you what to do to avoid more serious problems. And, of course, take the opportunity to like this video, subscribe to the channel, and share it with those who need to take better care of their health. Now, let's go together to the first warning sign. First sign: chest pain. The most known sign, and what you shouldn't ignore. When we think of heart problems, chest pain is the first symptom that comes to mind. But did you know that this sign does not always manifest itself in an obvious way? Many people believe that pain needs to be intense or unbearable to be worrying, but this is not the case. Heart-related chest pain can be described as a pressure, tightness, or heaviness in the center or left side of the chest. In some cases, it can radiate to the shoulders, arms, or even the back. The dangerous detail? This pain can last for a few minutes, disappear, and return later, something that often makes people ignore the problem. How to differentiate common chest pain from something serious? Heart pain. It is usually associated with physical exertion or situations of emotional stress. It may be accompanied by shortness of breath, cold sweat, or nausea. Muscle or gastric pain. It is more localized, generally worsens when moving or touching the region, and tends to go away with painkillers or rest. What to do if you experience chest pain? If you notice any persistent pain or discomfort, don't wait and see if it goes away. See a doctor immediately or go to the nearest emergency room. In situations of severe pain or accompanied by other symptoms, call emergency services. Every minute counts, as delaying care can increase your risk of a serious heart attack. Now that we understand the impact of not ignoring chest pain, let's move on to the next sign. Shortness of breath, a silent warning. Many underestimate. Second sign: shortness of breath, a silent warning. Many underestimate. Breathing is something so natural that when shortness of breath appears, it is easy to associate it with tiredness, anxiety, or even breathing problems. However, shortness of breath can be one of the first signs that the heart is overloaded. When the heart cannot pump blood properly, the lungs suffer, causing that feeling of suffocation or difficulty breathing. This shortness of breath, called dyspnea, can appear at specific times, when climbing stairs, during light exercise, or even at rest. How to identify if shortness of breath is linked to the heart? Does it happen at bedtime? If you feel short of breath when you lie down and it improves when you sit up, this could be a sign of heart failure. Does it accompany other symptoms? Shortness of breath, combined with extreme tiredness, swelling in the legs or chest pain, is a red flag. Is it progressive? If you notice that your difficulty breathing is getting worse over time, see a doctor. What to do when you notice these signs? First, don't underestimate. If shortness of breath comes on suddenly or intensely, especially accompanied by chest pain or fainting, call for help immediately. For less urgent situations, schedule an appointment with a cardiologist to evaluate your heart and lung health. And now that you know how to identify and act when faced with shortness of breath, let's move on to the third warning: excessive fatigue. When routine hides a heart problem. Third sign: excessive fatigue. When routine hides a heart problem. Feeling tired after a busy day is normal, but what about when tiredness becomes part of your life, even after a good night's sleep? This may be one of the most underrated signs of heart problems. Extreme tiredness occurs because the heart is unable to pump enough blood to meet the body's needs. This reduces the flow of oxygen and nutrients to your organs and muscles, leaving you without energy for simple activities like walking or climbing stairs. When should fatigue be a concern? Tiredness for no apparent reason. If you sleep well, are not experiencing periods of intense stress, but still feel tired that doesn't go away, it's time to investigate. Difficulty performing simple tasks. Activities like taking a shower or carrying groceries seem more difficult than before. Fatigue associated with other signs. When accompanied by shortness of breath, swelling, or chest pain, tiredness can be a warning from your heart. What to do to understand the cause of tiredness? See a doctor to perform tests such as an electrocardiogram or echocardiogram, which can identify whether the heart is working properly. Also, keep a record of your symptoms to help with assessment. Remember, don't normalize extreme tiredness. It could be the first step to preventing something more serious. Now, let's move on to the next sign that the heart may be sending. Swellings in the feet and legs, how your heart may be related. 4. Swellings in the feet and legs, how your heart may be related. Have you ever noticed your feet or ankles becoming more swollen at the end of the day? While this may just look like tiredness or fluid retention, frequent swelling can be a sign that your heart isn't working as it should. When the heart cannot pump blood efficiently, it ends up accumulating fluid in various parts of the body, especially in the extremities, such as feet, ankles, and legs. This symptom, known as peripheral edema, is more common in those suffering from heart failure. How to differentiate common swelling from something more serious? Persistence of swelling. If the swelling does not decrease with rest or elevating the feet, it may be a warning sign. Marked skin. Pressing on the swollen area with your finger and noticing that the skin takes a while to return to normal may indicate significant fluid retention. Bloating associated with other symptoms. Tiredness, shortness of breath, or sudden weight gain can also be related to heart problems. What to do if you notice frequent bloating? Elevating your legs while resting and reducing your salt intake may help temporarily, but consulting a doctor is essential. Exams such as ultrasound and cardiac evaluation are necessary to understand the origin of the problem. Practical tip: if swelling is accompanied by pain or redness, seek medical help immediately, as this could also indicate a circulation problem. Now that we know how swelling can be a warning, let's move on to the 5th sign: irregular heartbeats. What's normal and when they become dangerous. 5. Irregular heartbeats. What is normal and when they become dangerous. Feeling. Your heart beat faster or out of rhythm can be common after intense activity or in times of stress. However, when irregular beats appear for no apparent reason or are frequent, this may be a sign of cardiac arrhythmia, a disturbance in the rhythm of the heartbeat. Arrhythmias can range from benign cases, such as occasional palpitations, to serious, life-threatening conditions. Ignoring this sign can lead to complications like heart failure or even a stroke. How to identify a worrying arrhythmia? Accelerated or slow heartbeat for no reason. If you are at rest and feel your heart racing or slowing down too much, pay attention. Sensation of jumps in the heart. A beat that seems to fail or make jerks repeatedly may indicate problems. Other associated symptoms: dizziness, shortness of breath, fainting or chest pain, along with irregular heartbeats are signs that require immediate attention. What to do if you notice irregular heartbeats? Don't ignore. If you experience these episodes, see a cardiologist to investigate. Tests such as an electrocardiogram or Holter, continuous heart monitoring, can help identify the problem. Avoid stimulants. Caffeine, alcohol, and tobacco can worsen arrhythmias, so it is important to limit the consumption of these substances. If irregular heartbeats are accompanied by fainting or severe symptoms, seek emergency care immediately. Now that we understand the importance of monitoring your heartbeat, let's move on to the next sign. Fainting or dizziness, your body's cry for help. 6. Fainting or dizziness, your body's cry for help. Feeling dizzy or even fainting can easily be associated with tiredness, hunger, or a drop in blood pressure. However, these episodes can also be warning signs from the heart that something is wrong. When your heart can't pump enough blood to your brain, you may feel dizzy, lightheaded, or even lose consciousness. This may be related to conditions such as arrhythmias, heart failure, or heart valve problems. How to differentiate common dizziness from cardiac signs. Dizziness when standing up. This may indicate orthostatic hypotension, which in some cases is linked to heart problems. Frequent fainting. Repeated episodes or episodes associated with physical exertion or stress should be investigated. Other symptoms present. If there is shortness of breath, irregular heartbeat, or chest pain, along with dizziness, the cause may be in the heart. What to do if you experience frequent fainting or dizziness? Seek medical help immediately. Persistent dizziness or fainting should never be ignored. A cardiologist may order tests such as an echocardiogram or heart rhythm monitoring to evaluate possible causes. Avoid dangerous situations. If you are prone to fainting, avoid driving or operating machinery until you know the cause. Practical tip: write down the times, situations, and symptoms associated with these episodes. This information can be crucial for the correct diagnosis. With that, we move on to the last and perhaps most surprising warning sign: pain in the arms, jaw, or neck. Atypical signs that save lives. 7. Pain in the arms, jaw, or neck. Atypical signs that save lives. When we think about signs of heart problems, we often just focus on the chest. But did you know that pain in areas such as the arms, jaw, or neck can also indicate that something is wrong with the heart? These symptoms, known as referred pain, occur because the heart shares the same nerve pathways with these areas. Therefore, during a heart attack or other heart problem, pain can radiate to unexpected places. How to identify this atypical pain? Arms. Pain may appear in one or both arms, especially the left. Sometimes it comes as a feeling of heaviness or numbness. Jaw. Unexplained discomfort in the jaw, often mistaken for toothache, can be a worrying sign. Neck. Feeling of tightness or pain in the neck, especially accompanied by other cardiac symptoms, should raise an alert. Why are these signs dangerous? Because they are uncommon, many people ignore them or delay in relating them to a heart problem. This delay in recognition can cost precious minutes in cases of heart attack. What to do if you feel these pains? Don't underestimate the symptom. Any unexplained or persistent pain in these areas should be evaluated immediately, especially if it is accompanied by tiredness, shortness of breath, or cold sweat. Seek emergency help. In cases of sudden and intense pain, call the emergency service and report the symptoms. These atypical signs are a reminder that our body often warns us, but it's up to us to listen. Now that we've covered all 7 signs, let's conclude with a summary of key points and practical tips for taking care of your heart health. Protect your heart. It is talking to you. Now that you know the 7 warning signs that your heart may be sending you, it's time to act. Chest pain, shortness of breath, extreme tiredness, swelling, irregular heartbeat, dizziness and pain in unexpected areas such as the arms, jaw, or neck are symptoms that should never be ignored. What can you do from today? Don't neglect symptoms. If you notice any of these signs, seek medical help immediately. Many conditions can be treated if identified in time. Adopt a healthy lifestyle. Exercise regularly, have a balanced diet, and avoid excessive consumption of salt, alcohol, and cigarettes. Get regular checkups. Preventative consultations with a cardiologist can detect problems before they become serious. Share this knowledge. Someone you love may be ignoring dangerous signs. Send this video to family and friends. It could save lives. Remember, the heart is the engine of your body. He works tirelessly every day to keep you alive, and when something is wrong, he sends signals. Hearing these warnings can be the difference between health and something more serious. Finally, if you found this content useful, like the video, subscribe to the channel and activate the bell so you don't miss our next tips. Let us know in the comments if you have experienced any of these symptoms or have any questions. We will respond carefully. Take care of your heart and your health. Until the next video.